Hello, in my last video, we discussed about Crimean Congo Hemorrhagic Fever. And I mentioned that Crimean Congo Hemorrhagic Fever is a tick-borne viral disease that causes severe hemorrhagic fever. And in my last video also, we talked about the history of Crimean Congo Hemorrhagic Fever. We also talked about the signs and symptoms that are associated with this disease. We mentioned the prevention and the control measures. So please, peradventure you have not seen this video, you can look back and you will see the video. But today we are going to be looking at recent outbreaks of Crimean Congo Hemorrhagic Fever. What are the recent outbreaks? But before I go in there, remember that in the transmission of Crimean Congo Hemorrhagic Fever, the tick known as Hyalomma tick, adult Hyalomma ticks are the carriers of the virus called norovirus, the virus that causes Crimean Congo Hemorrhagic Fever. And in this is just showing a cycle. It's just showing a cycle where we have the adult tick carrying the virus, and then the adult ticks can also bite animals, particularly animals that are referred to as ungulates. And what are ungulates? They are large, mostly large mammals with hoofs, large mammals that have hoofs. Animals like cattle, like sheep, like giraffe, like pigs, like horses, like deer, like hippopotamus. They belong to the same family known as ungulates. So if the tick carrying the virus bites an animal, these animals can transmit, they can become sick with this virus, with the disease, and they can also transmit it to man. They can also transmit the virus to man. And then there are also reports of human to human transmission. So this cycle, this circular flow is simply showing us the way this virus is transmitted, the way the disease causing virus is transmitted. So we are going to look at are the recent outbreak of this disease in Africa. Now from this table we can see that in Africa, in Mauritania, in 2003, there were 35 cases. In South Africa in 2011, there were 17 reported cases. And then in Uganda in 2013, there were 5 reported cases. In Senegal in 2015, there was 1 case. And in Uganda, in 2018, 4 cases were reported. Now, of course, this information is from the African Center for Disease Control and Prevention, and that this I extracted on the 28th of March 2022. So, remember we mentioned that wherever the tick that carries the virus is found, that's where you can find this disease. So, in areas where you have Hyalomma ticks, they can transmit the virus. They can transmit the virus that causes Crimean Congo Hemorrhagic Fever. Then in the European Union or European Union economic areas, these countries, there are reports of this disease. In Bulgaria in 2013, there were 8 cases. And in Spain, 2013, 1 case was reported. In Bulgaria, 2014, 8 cases. Bulgaria again in 2015, 4 cases. In 2016, 4 cases were also reported in the same place. And in Spain, 2016, there were 2 cases. And in 2017, 2 cases were reported in Bulgaria. In Greece, in 2018, there was a case reported. And then again in Bulgaria, 2018, 6 cases were reported. Then the list goes on and on. Till 2021, in Spain also 2 cases were reported. This information was extracted from the European Center for Disease Prevention and Control on the 28th of March 2022. So this Crimean Congo Hemorrhagic Fever is not just a fiction. It exists, and these are some of the reports. Of course, it may be beyond the presence of this disease, may be beyond the reported cases, but these are the documented cases. So again, in the United Kingdom, in 2012, 2 cases were reported. And in 2014, a case was reported. And this year, 2022, one case was reported. A case was reported, I think a woman who traveled or someone who traveled outside the country to a region of this tick infestation actually came back with the virus. So these cases are the ones reported in the United Kingdom. Now in other continents like Asia and the Middle East, now it is believed that these regions already have large burden of these cases. So yearly about 5 to 49 cases are reported in Asia, in Asian countries, according to World Health Organization, and in the Middle East, over 50 or more cases are reported yearly. Over 50 or more cases are reported yearly. So the virus and the disease, Crimean Congo Hemorrhagic Fever, actually exists. So peradventure you travel to regions, you make a travel and you return to your country, and you happen to fall sick, please report to a doctor for appropriate diagnosis and care. And this is the information for today. I just like you to stay safe and be healthy. Have a blessed day. Bye-bye.